G'day everybody. It's always lovely coming to forums like this to meet with people who are positive, enthusiastic, who actually recognise nonsense when they see it, and who are really committed to all the things that we're fighting for. So thanks heaps for the invitation, and I hope to give you a bit of an opportunity to do some Q&A at the end of this, because I often find that's the most valuable part of a session like this. I'll tell you a little bit about my journey, about how I ended up coming to be where I am, a little bit about some of the issues that I think face us both here in Australia, but really collectively as a species, and then talk a little bit about the state of the world, global politics, and perhaps some opportunities for how we shift things along. So as you heard earlier, I come to this role not from the traditional route. I didn't spend my life working for a political staffer or sitting in a union or running a business lobby and then, follow the well-worn path into Parliament. I came at this through health as a GP. I had very little knowledge about what the future would hold for me, and I have to say, when I was graduating from medicine, the last thing on earth I thought I'd be doing is standing up as a leader of a political party giving a speech like this. I basically, like a lot of people who work in the field of health, I was motivated, I'd like to think, from a sense of actually wanting to help people live longer, healthier lives, and that was really my motivation for getting into medicine. And on the way to doing that, I spent some time working in an Aboriginal health organisation and really enjoyed that, and so committed, before I did anything else, to spending a couple of years in the Northern Territory, a place called Tennant Creek, where I worked for the community controlled health organisation there as a GP. And I suppose of all the things that I've done in my life that have sort of helped shift me to politics, that was the thing that had the most impact. You're working in an environment there as a clinician where you might be writing a script for diabetes or a script for some antibiotics for an infection, but what you're really doing is you're seeing the end result of a whole lot of upstream factors, we now call them the social determinants of health, that influence the people's health outcomes and really shape their lives. When you're there sitting opposite somebody who's 10 years old and has got end-stage renal failure, and you're making referrals for them to go and get urgent dialysis with a view to a kidney transplant, there's really not much you can do in that clinical setting. You know that so many of those factors are upstream factors. When you've got people who are having their limbs amputated from end-stage untreated diabetes, when you've got young kids whose failure to thrive and developmental delay is because they've had chronic ear infections and they're deaf and English is their third language, how on earth in that environment do you expect people to learn? And of course that puts them at a huge disadvantage right from the start. So that was a really powerful experience for me, and it was one of the things that made me realise I need to get more active in politics. And I think, for me, politics was an extension of my life as a physician. There's a very well-known German physician, a guy called Rudolf Virchow. He was a physician, writer, turned politician, and his view was that medicine's a social science and that politics is nothing but medicine on a big scale. And that's always been the view I've taken. So some people can't make the connection. They say, how on earth, like my dad, you were a doctor, Richard, and now you're a politician. Some people can't understand the connections, but for me the connection's a very obvious one. So after that time in Tennant Creek, I went and did my public health training, and I spent a few years in public health, doing a range of jobs, and ultimately worked across the road for NOSL, the NOSL Institute. One of the programs we had there was huge pocket of HIV transmission amongst young people who were injecting drugs, and it was largely a trafficking route. A lot of heroin coming out of the Golden Triangle, made its way through northeast India, then on to China and through other routes. And along those trafficking routes you had kids 12 years old shooting up, HIV, prevalence of 50% of HIV in some of those communities. And through the nozzle, we were able to get some funding from Bill Gates, and it was classic public health. Needle and syringe exchange, drug substitution treatment, primary care, education, all of the things that we know work, and we had huge success in helping to reduce the number of people who were contracting HIV within that community. And working with a whole range of disadvantaged groups, with sex workers, with communities, with health professionals, with government, and we managed to get a lot of that work basically being mainstream within government programs. So it was really a combination of those things. I continued on with my public health work, decided I'd join the Greens. The Greens were a party that spoke to my values. So I joined the party at a time when, it was back in 2000, you drove past the office, you're probably being asked to stand as a candidate. And we were a very small organisation back then. And over a period of time, working both as a public health physician, but standing up and being an advocate politically for the things that I believed in. Ultimately, our vote grew, our party grew, and I found myself in a position where I was fortunate enough to be elected, and I was elected in 2010. The work that I do as a politician is always informed by the professional life I had before being a politician. And in some ways it probably doesn't make me a very good politician, because there are aspects of politics that I despise. I despise the tribalism, I despise the lack of evidence-based policy. I despise the fact that there's a total lack of courage within our current political climate at the moment. And one of the challenges as somebody who comes from a non-political background is trying to be faithful to all of the reasons that brought you there, but also allow you to still be effective as a politician and to work within the system that effectively means that decisions get done. One of the things, of course, at the moment that we're facing here in Australia is how we respond to the urgent challenge of dangerous climate change. And I would say categorically that it is the biggest threat that we face collectively as a species. This is an existential problem that we're all dealing with. And I said when I took on the leadership of the party, people, often want to know what's the issue that's most important to you. And of course, we're all motivated by different things. But if we cannot come together collectively and respond to dangerous climate change, then the world that we are creating for our children and our grandchildren will be a vastly different world to the world that we enjoy. It is very much an existential challenge. Some people talk about this as the Anthropocene. This is the era in which we are influencing the world around us and shaping it in a way that has never happened before. That it is our humanity that is creating the conditions for life on Earth. And we have no excuse now. We know that we are doing that we are very literally shaping the living conditions around us. And the challenge for us is, are we able to respond in time to ensure that we hand down a quality of life to future generations that is the life that we enjoyed. It's pretty hard though when you've got a government at the moment talking about extending the life of a coal-fired power plant. It's pretty remarkable when you've got the owners of the plant saying this is really a piece of junk and it's at the end of its useful life, and we recognise that actually the world's moving away from fossil fuel generation and we want to be in the renewables business. This is the head of AGL, and you have a government standing in and saying, well, hang on, we think we're going to need to put some taxpayer money into extending the life of the plant. You think it's sort of ironic when here they are jumping up and down accusing Bill Shorten and the opposition for being, Stalinist interventionists, and here they are wanting to throw good money after bad to try and extend the life of one of the country's most polluting coal-fired power plants. And that, sadly, is the debate that we're having in the Parliament at the moment. Come in there with pieces of coal, waving it around as though it's a big joke. We're now at a state or at a decision point where we've got to decide whether we as a nation allow the Southern Hemisphere's biggest coal mine to go ahead, the Adani mine. Now, if that mine was a nation, it would be the 7th biggest emitter on Earth. That mine alone, it is going to create huge problems for the local environment. Should that mine go ahead, not only will it cause tremendous local destruction, but it will result in, as I said, huge pollution that ultimately means we say goodbye to the Great Barrier Reef. And I'm not sure if any of you have had the opportunity to go and visit it recently, but that is an unfolding catastrophe. We are seeing bleaching on an unprecedented scale, and I was speaking to climate scientists, some of whom fear it's already too late. So we're at a very critical point, and it is so important that we address it. We have right now in the Atlantic unprecedented storms. Some of the conditions are off the charts. They've literally never recorded wind speeds as high as they have in some of those superstorms that are now reaping havoc, both in the Caribbean and now potentially in Florida. It's a sign of things to come. And we have a huge responsibility, all of us, to do everything we can to try and prevent that from happening. I just urge all of you to get involved in the campaign to stop Adani and to do everything you can to help us make the transition to a clean, green, renewable energy future for all of us. There are so many other things I could talk to you about in terms of global health challenges that confront us. I could talk to you about what we see is traditionally within the global health space, the incidence of communicable diseases. We know simply diarrheal diseases have a huge impact on morbidity and mortality in low-income countries. We're seeing this alarming rise in non-communicable diseases. We're seeing the rises in diseases like diabetes, heart disease, peripheral vascular disease and so on, often so-called diseases of affluence. And that change is actually a very significant one and a rapid one. In part, it's being fueled by changes in diet and so on, but it's also being fueled by the fact that we've got the tobacco industry where we're seeing declining rates of tobacco consumption in countries like Australia because of effective public health interventions, things like plain packaging, things like restrictions on advertising and sponsorship, things like price and using price as a lever to drive down consumption. While the industry's now recognised huge opportunities in low-income countries, and they are turning their sights now on low-income countries, we're seeing these alarming increases in the rates of smoking in many of those nations. Of course, the consequence of that is a rise in those non-communicable diseases. The question for us is, how do we respond? What we do know is that inequality in and of itself is also a significant a predictor of the health status of both individuals and nation states. So inequality is, we're talking a lot about it here in Australia, but it is such a problem right across the world. And I have to say, just bringing it back to a political context, part of the reason I think that we're seeing the emergence of Donald Trumps of the world, Brexit in the UK, the rise of the far right, the Marine Le Pens of the world in France, is in part grounded in the fact that we are seeing rising income inequality within nations. We're seeing that get worse, and we're seeing a complete lack of faith in political institutions to respond to that. Indeed, often, it's political institutions that are seen as the problem. And that's partly because we've got huge donations made by industry to political parties, and we know that that influences the outcomes we get in our parliaments. One of the first lessons I learnt was in 2010 when I got elected to the parliament. I had the gambling portfolio. And, I went in green, both literally and green around the ears as well. And I was staggered by the role of the gambling industry when it was then the Gillard government with the support of the Greens and other crossbenchers, One of the conditions for the government to survive was that they had to make changes to the way poker machines worked in Australia. Reasonably modest changes, but they would have made a difference in terms of the amount of money that people would lose when they played on the pokies. Now, it's effectively, in my view, a way of taxing people on low incomes when governments are too gutless to actually raise taxes for people on high incomes. You look at where they're concentrated, you look at the tactics used by the gambling lobby, and ultimately it's a way of fleecing people on low incomes. Poker machine reform was hugely popular at the time. Most of the community wanted reforms to pokies. The government's very survival depended on it, and yet I got elected and I just distinctly remember walking down the corridor, and for about 2 weeks you couldn't miss a lobbyist from the gambling industry. They were going in and out of people's doors, they were in the lifts, they were everywhere. So you had the Hotels Association represented, you had the gambling industry represented, and what you saw was that industry both threaten in terms of running campaigns, but also threaten in terms of withdrawing big campaign donations, both sides of politics. And yet, despite the fact that we had a very popular reform, despite the fact that we had a reform that we know would have made a big difference to people's lives, despite the fact that the reform was a condition for the government to survive, the government walked away from it in the face of that campaign. And it was a really big lesson for me to learning about the power of vested influences on the political system. Hugely powerful. In gambling, we see it in alcohol, we see it in housing, we see it in the minerals industry. And it's one of the reasons that we're fighting so hard to get action on global warming, because fossil fuel industries are huge donors to both our major political parties. So what we're seeing is a community who are saying, we haven't felt the benefit of economic growth. In fact, we were told over a number of decades that if we simply deregulated markets, if we reduced the power of unions, if we let the market rip, that we'd all be better off. Trickle-down economics. Instead, we've seen wages pretty flat. We've seen the top end of our community when it comes to income increase, and we've seen the gap between the rich and poor increase as well. That is partly what is fueling this reaction right across the world to established political parties, and it's happening here in Australia as well. What we are seeing is a growth in the non-major political party vote. We're seeing the rise in groups like One Nation and other smaller parties because there is a lack of faith in people to represent us. And that's one of the great challenges that we have ahead of us. If we are going to take action on these issues, then we have to make sure the way a democracy works is reformed. That means getting rid of the influence of corporate interests, no more donations from large corporations, and a move to publicly funded election campaigns. It means stopping the revolving door between politics and industry, that you can't continue to be a minister and then within 5 minutes of losing your position or resigning your seat, you're off working for the industry you were once in charge of. Those are the sort of things that have to change, that have to be reformed if we're going to give people some faith in the way our democracy works. I would just probably finish with a few things. I'm hopeful about the future, because ultimately I know when you look at, and I come and speak at forums like this, when I speak to people on university campuses and so on, that they understand, the big challenges that are facing them. They understand that ultimately what we're seeing is this great intergenerational divide that is big and growing, and that it's our responsibility to do something about it. They understand that policies in our parliament need to be based on evidence rather than ideology, and they understand that when it comes to issues like climate change, there's a huge urgency in which we need to act. The challenge is, how do we get there? How do we get there? And that's a much harder part of the equation. People will often say to me, this is what you need to do. If the Greens are going to continue to increase their vote, you just need to do this or that. And my response to them is always this: yes, but what are you going to do? What are you going to do? How are you going to engage in this democracy? How are you going to try and influence the world around you? Now, not all of you are going to have the opportunity to do what I've done, and to be frank, many of you couldn't think of anything worse, and I don't blame you. You don't have to be a member of a political party, although I would urge you all to have a look at our website and think about joining the Greens. But if that's not your cup of tea, there are other ways of getting involved in the world around you. You'll be involved either professionally or in some way with an issue that you care about. Get active and involved on that issue. If you care about climate change, join a group that's out there campaigning on climate change. If you care about climate change, have you spoken to your local Member of Parliament to try and express to them how important it is? If you're a member of a particular group within your community, whether it's a professional organisation or something grounded in where you live, have you collectively organised to meet with the local Member of Parliament to let them know how you feel? If you worry about the treatment of innocent refugees and asylum seekers, have you joined an advocacy group that is working to try and show some humanity towards innocent people seeking asylum? The only way we are going to change the world around us is by engaging in the world around us. And if it's not directly through politics, as I've done, then find the vehicle through which you can do it. And one of the things that you have as health professionals that I lost when I became a politician is you've got the respect of the community. And I remember having that white coat, you know, and when I put on that white coat, suddenly people listened to what you had to say. And for many of you, in the world that you'll be moving into through the work that you do, you'll have that respect. Find the vehicle through which you can make a difference, because that's the only way we are going to make a difference. Thanks, everyone.